We now move on to the question of the why. Let's accept that patient and public involvement, it takes time, it takes effort, it takes resources. So why should we do it? Well, I'm going to outline 4 key reasons, and I don't suggest this is in any way an exhaustive list, but these are 4 key reasons that I think is why we should involve patients and public in research. The first one is that patients and public offer a different perspective from the rest of the research team. They're going to have knowledge that clinicians and researchers won't have. Patients are more likely, well, they will have lived experience of a particular condition or a service. They will know how drugs and services impact upon them, the challenges that they face in everyday living, the side effects of therapies and treatments and drugs, the impact on their quality of life. And I think this can help to improve the research quality and the research relevance. Patients and public can help recruitment procedures, making them more sensitive to various communities. They can help ensure patient information sheets, protocols, consent forms are in plain, accessible language. They can make sure, of course, that the questions you ask in your research are more relevant to the population, that your methods are more acceptable for any given population. In every industry, product development begins with a clear understanding of the needs of the end user, and I think aims to provide solutions to meet that need. For example, the company Apple wouldn't develop a new iPhone without consulting the public or involving the public in some way. And I don't see why that should be any less relevant for health and social care research. So I've given you 3 key reasons there, and I hope that you'll all take at least one of those on board. But if you don't, we come to my 4th rationale, and that is increasingly you have to. Increasingly, it's become a standard to involve patients and the public in your research. It's becoming essential. So the organisation I work for example, are quite clear about this. We expect the active involvement of members of the public in the research that we fund. And quite frankly, if you cannot demonstrate that in a research proposal, then it's very, very unlikely indeed that you'll receive funding from the National Institute for Health Research. And not only that, members of the public will review your research proposal, and they also sit on our funding and commissioning boards and panels, support our decision making. And when the public do that, they're often looking for evidence of good, strong patient and public involvement in your research. But of course, it's not just a UK phenomenon. That would be arrogant to suggest so. This is global now. And I've just got a range of organisations there from the US, Canada, Europe, increasingly require patient and public involvement in research. It's increasingly becoming the norm. So I've given you there some rationales as to why we include patient and public involvement in our research. Giving you 4 rationales there. I hope that all of you will take at least one of those on board and agree with at least one of those, hopefully more. Anyway, so that's the what and that's the why. And now Katie is going to talk now about how we do patient and public involvement in research.